Hello everyone, welcome back to my channel guys. So today I'm here to discuss one of the high yield multiple choice question. So this is a 5-year male child who is brought to the office with poor feeding, lethargy. Parents report his urine have a sweet smell. The child, two older brothers are healthy. On examination the child is vomiting and hence dry mucous membrane. There is hypertonia. Which of the following options should be restricted from the child's diet? So what are the positive points? This is a 5-year child with poor feeding, lethargy, urine has a sweet smell, and then there is vomiting, there is hypertonia. So what are the options should be restricted? Is it option A tyrosine, leucine, phenylalanine or galactose? Since by looking at the vignette guys, the urine smell, the sweet smell, I'm sure that it must have diagnosed maple syrup urine disease. And before we see that why the leucine is the correct answer and reasoning why other answers are wrong, okay, let's understand the metabolism normally and what happens in maple syrup urine disease. Now the branch chain amino acid, what are the branch chain amino acids? Those are the valine, isoleucine and leucine. So with the help of branch chain alpha ketoacid dehydrogenase, so it is a thymine dependent enzyme. So guys, let me know in the comment section what are the other thymine dependent enzyme. Okay, so with the branch chain alpha ketoacid dehydrogenase, the valine will metabolize to propenyl CoA, which will ultimately form the succinyl CoA. Isoleucine will metabolize to propenyl CoA and then ultimately succinyl coenzyme A, and then also isoleucine will form acetyl CoA. Leucine will, with the help of branch chain alpha ketoacid dehydrogenase, will form isovalerial coenzyme A and then to acetyl CoA and acetoacetyl coenzyme A. They will all enter into the TCA cycle. Now in maple syrup urine disease, what happens that there is a deficiency of branch chain alpha ketoacid dehydrogenase enzyme. So when there is a deficiency of this enzyme, there is a buildup of this branch chain amino acids like valine, isoleucine and leucine, especially leucine, which is neurotoxic. That is why this child was presenting with poor feeding, lethargy and then hypertonia. They are also very irritable. Okay, and how do you diagnose this condition? There will be elevated branch chain amino acid, they can be elevated. Okay, and that is confirmatory that when these levels are elevated, that is confirmatory, and then you have to restrict with leucine, isoleucine and valine. So because this enzyme is not there, the level is elevated, so you have to restrict leucine in the diet. That is what they are asking, which of the following options should be restricted from the child's diet, and that should be leucine. Right now, why tyrosine is not the correct answer? Now tyrosine guys, as you know that this is important in alkaptonuria. So what happens in alkaptonuria, where there is a deficiency of homogentisate oxidase? Okay, so the homogentisate will build up, all right, and they will cause bluish black connective tissue and your cartilage, and the urine will turn black when exposed to air. We don't see any of the thing like that, right? So with urine turning black or bluish black connective tissue or your cartilage, those manifestations are not there. So tyrosine is, that's not alkaptonuria, and this is not the diagnosis, and then you will restrict tyrosine. Now phenylalanine, as you all know that phenylalanine is again phenylalanine hydroxylase is the enzyme which can be deficient in phenylketonuria patients where the phenylalanine is high, and that will come in the urine. And if you don't treat patients with phenylketonuria, then the patient can have seizure, they can have intellectual disability, they will have decreased skin pigmentation, right, which we don't see this manifestation here. So that answer C is not correct. Now galactose guys, galactose is important in patients with galactosemia. So in galactosemia patients, you can restrict the patients with galactose. Why? Because This is again an autosomal recessive disorder where the enzyme deficient is galactose 1 phosphate. Uridyl transfer is deficiency. So there will be buildup of galactose, and the neonate can have jaundice, cataract, hepatomegaly, which we don't see it here, right? So you don't have to restrict with the galactose, all right? So I hope guys this short video has helped you, and please like, share and subscribe. I'm saying that lot of members who are watching the video but not subscribing it. If you subscribe, then that will boost me to make more high yield videos. Okay, thank you very much guys.